You're looking at the White House right now. Why? Because the White House says First Lady Jill Biden continues to have mild COVID symptoms after testing positive on Monday. Now, yesterday, President Biden wore a mask for the first time in months, but he did take it off after a short time at a Medal of Honor ceremony for a Vietnam veteran. So far, the president has no symptoms, and he will continue to test regularly, we're told. Nationwide, hospitals, as you've heard, are seeing double-digit percentage increases in infections. So we're very curious about that. We're talking today to Dr. Megan Ranney. She's Dean of Yale University School of Public Health. Good morning to you, Dr. Ranney. Good to see you.
Good morning, Gayle.
Do you have any concerns about the First Lady's health or the risk to the president at this time based on what you know and what you've seen so far?
So it's tough to say without being her doctor, but certainly anyone over the age of 65 is at higher risk of those bad side effects of COVID. Now, I expect that First Lady Biden has had both her vaccinations and all the boosters that she's been allowed to get up until this point. And I would also expect that she's been put on on Paxlovid. Those together greatly decrease health risks for her, and hopefully she will have an uneventful course of COVID and a quick and easy recovery. But to me, the big thing for both her and for the president is the reminder that COVID has not gone away. Yeah. Unfortunately, it is out there and is in a bit of an uptick nationwide.
Yeah, what are the risks to him? I mean, is it inevitable that he will get it too? I know he continues to test negative, but I hear this story all the time about couples who one partner will get it, they'll test negative, and then the next day it's positive.
Yeah, that's exactly right. You know, most people who are a close contact of someone who has had COVID are going to test positive somewhere between 2 and 7 days after their last exposure. Now, President Biden has been isolated from Dr. Biden since the positive test, has had all of the advantages of good ventilation and all the protections that he gets as president. Those will decrease the chances that he does turn positive, but we're really not going to know if he's out of the woods until 7 to 10 days after he was last around her. For the rest of us who don't have the advantages of the president, chances are we're still sharing a house or a room with our roommate or our loved one who turns positive. The important thing for us, if we are in that situation, is to mask around the person who's positive, to improve ventilation, open windows, or use an air filter. And of course, if we can, to try to separate ourselves from them to decrease the chance of getting infected.
So let's talk about this COVID booster that's coming out. When is it coming out? Who should get it? And how effective is it?
We are real excited for this new COVID booster. We're expecting that it's going to be released in a week or two. The CDC is meeting next week to approve it. The data to date suggests that it is going to be quite effective against these new variants that are getting so many of us sick right now. We don't know the exact recommendations for age, but I will tell you, based on all the data that we have to date, say that anyone who's age 60 plus should go out and get that booster. Because again, those older folks are higher risk for those bad complications of COVID, and your immunity has likely waned over the last year since your last booster. So people who are age 60 plus should get it. People who are pregnant should get it because you are also higher risk. And getting the booster protects not just you, but also your baby. And then folks who are immunosuppressed, getting treatment for cancer or for Crohn's disease or for rheumatoid arthritis, those folks should also go get the booster. For the rest of us, talk to your doctor. It may well be something you should choose to get. And again, for most of us, it's going to be available between 1 week and 3 weeks from now, depending on how quickly they roll it out after that expected approval on the 12th.
Well, you don't have to tell me twice. I'm going to try not to trample little children to get mine. I can't wait to get it. Thank you very much, Dr. Megan Ranney. I want to live. Thank you very much, Dr. Megan Ranney. Very good to see you.